Support for the WBFO Mental Health Initiative is provided by the Patrick P. Lee Foundation. The Lee Foundation envisions a community that is well informed about mental health, inclusive of people with mental illness, and served by high-quality treatment services. Learn more at www.lee.foundation.
Good afternoon, everyone. I'm senior reporter Eileen Buckley, and welcome to the WBFO Facebook Live conversation in pursuit of healing. And as part of our WBFO Mental Health Initiative, we are here to look at what perhaps caused stigmas around mental health and illness. And in our conversation today, we'd like to look at some of the past history and share stories of those who have experienced mental health challenges. Our guests are in studio today, Dr. Celia Spicone. She is coordinator of the Suicide Prevention Coalition of Erie County. She is also the former and retired executive director of the Buffalo Psychiatric Center. Karl Shallowhorn is coordinator of education and training at Community Health Center of Buffalo. Karl is a mental health advocate and has been treated for mental illness. And Kelly Marie Showard is director of community relations at ECMC, and she too has dealt with mental illness. And you also serve as an advocate in the African American community. I want to thank you all for being here today to start this conversation and lend your expertise, lend your experiences so that we can help everyone out there in our community. And welcome to you all to Facebook. And a reminder to our Facebook viewers, please send us your questions. We'll try to get in as much content as possible in the time that we are putting on this live conversation today. So thank you all for being here. Well, we've been planning this for several weeks for this conversation, but in the midst of our efforts, we did have the tragic news of 2 celebrity suicides last week. First, fashion designer Kate Spade, followed by celebrity food writer and chef Anthony Bourdain. Another reason to talk about this and try to break the stigma surrounding mental illness and suicide. Spade, we learned, was under some treatment for depression and anxiety. Bourdain had talked about past struggles of depression and drugs. And also last week, the CDC issued some new suicide numbers indicating the rate across the U.S. on the rise, nearly 45,000 lives lost in 2016. Dr. Spicone, I really want to head to you first, because when this occurs in the service provider realm of what you're doing now, is there an uptick in the calls that come in and the search for help from those in need, from family members?
I work out of Crisis Services, which handles the 834-3131 crisis hotline. They have had a small uptick in actual calls looking for assistance. But if we go back to the experience when Robin Williams took his life, it was a few weeks later. I know there's a lot more discussion going on, a lot of people with questions and concerns, and I've seen a lot of people on Facebook actually revealing that they have received mental health treatment, which is a good thing, that it's caused some people to feel more comfortable to say, this could have been me. You know, I've struggled as well, and I think that's been a good conversation that's come out of it.
Certainly important in breaking the stigma and opening up these conversations. It's key, because we're all told that mental health is a part of all of our lives, and sometimes it's put on the back burner of our overall health. Kelly, you have some compelling stories to tell about your situation, and I know when we initially spoke over the phone, you said, my life is an open book. I'm going to turn to you, since we are on the topic initially of suicide. You made an attempt at one point in your life, and I know you've struggled with some mental illness, some chronic depression, anxiety, panic disorder.
Yes. So I've actually made 2 suicide attempts. The first was when I was 14, and I'd forgotten about it. I disclosed it to my therapist, and we were talking about my most recent attempt almost 5 years ago. And, you know, he was just going back over things with me, and, you know, was this different than, you know, when you were a teenager? And I'm like, what are you talking about? What do you mean? This is the first time that I've ever attempted suicide. So, you know, the mind is complex, you know, and it keeps you safe as its default. So having to go back and peel the layers back on the depression, and peeling the layers back on the anxiety, and, you know, what happened at 14 that, I mean, I didn't know about suicide then. It wasn't something, I mean, we're talking about it now, but it's not something that we talked about just a couple decades ago. So it's
So when you heard of these celebrity suicides and it brings it to the forefront, we want to keep the conversation moving beyond that.
right.
What was your reaction? And
You know, I've learned to be okay with who I am, where I am, and I don't believe that that's something that we do as a society. We really push people to attain more, to strive for more, for better, to have more wealth, to have more things, to, I mean, even seek your purpose. You know, go out there and do it and find it. Know what you want to do by you're 17. So it's just, for me, it was sad because these are people that have seemingly reached the pinnacle of their career. Like they're doing what they want to do. They're loved. They have, you know, money is not an issue. So they have everything that we say we're supposed to have, and it wasn't enough. So there's something I really believe that we're missing, and that their deaths were a reminder to me of what's important. And I love the work that I do. I love things. Kate Spade is my favorite designer. But those things ultimately don't make me or keep me happy.
Karl, join our conversation with the ladies here. I want to bring you in. Your reaction to the tragic deaths, of course, and the work that you've done.
Well, it's interesting. I remember, of course, hearing about Kate Spade last week, and then the morning that Anthony Bourdain's news came out, I saw it online, and I literally felt I had a visceral reaction, like it hit me in the stomach, and I actually became tearful. And so, I mean, I just really reacted because in the end, it's just so terribly sad to hear about someone, you know, taking their life. And I even know from my own experience, I too have attempted in the past, and I know what it feels like to have that pain and that feeling that there's no way out and that feeling of hopelessness. However, I have also learned through my own journey in recovery that there are ways to get out of that hole, to find a way to live and overcome those struggles that a lot of people have. And one of the things I try to do in the work as an advocate and as an educator, I mean, my mantra is recovery is possible. And I believe that everyone, no matter what situation they're in, they don't have to go to that place of feeling like they need to take their life.
And Karl, you've dealt with bipolar.
Yes. Yeah, I originally actually had my first episode in 1981. I was a college freshman. It was pretty much a textbook case, you know, being away from home for the first time, not many supports, drugs and alcohol, the stress of school. It all kind of came crashing in one moment of time, and it really changed the course of my life forever. It really did.
What perhaps saved both of you in all of what you've been through?
Well, I would say there's a number of factors. For me, certainly the first and foremost was stopping the use of substances and alcohol. That was really the one that I think kind of was a catalyst, I guess I could say, for my recovery. But as much as anything, family support. I received wonderful family support from my parents, both of which were no longer with us. But and also even extended family. I was very fortunate, which some people aren't these days, but I was very fortunate to have a family that was behind me, and even a mother that was kind of pushing me in a way to really go beyond where I thought I could. And we even know today, even research has shown that family support is very important in the equation of recovery.
I would have to say that for me, for the first time, so as a teenage mom, I went from living at home, I went away to college for a year, and then I had to build my own home. I didn't learn how to actually take care of myself until I was hospitalized. And those 2 weeks were the first time in my life that I was able to focus on me. I could not do anything for my children. I could not go to work. There was nothing for me to do besides take care of myself. And, you know, learning that, you know, it's cliche, you know, self-care is the best care, but that's real. I mean, that's actually what it is. And learning to say no. It's helped, you know, with boundaries and being able to give myself space to just be me.
And control your life around
Yeah.
you. Yeah. Dr. Spicone, you and I have met in a previous interview, and we talked about the past history of the former Buffalo what was known as the Buffalo Insane Asylum. And some of the stigma, I believe, started to occur with the deterioration of that center and the change into the new Buffalo Psychiatric Center, when we've heard the stories of treatment, of lobotomies and shock therapy, and then the overcrowding of the facility. And you spent 30 years of your time, about 30 years of your career in the current psychiatric center. It has to be fair to say that caused a lot of the stigma that people are fearful of talking about mental illness to this day.
Well, if you look at the history of how we used to explain mental illness when we didn't know anybody, and I'm going back years and years, it was rooted in being demonic possession and spiritual decay, things that were very frightening to people. And mental illness, it's hard to see. It's not like sores or a cough or a broken arm. You don't see it, so people don't know how to understand it. And I think some of the root of stigma actually goes back even further than the history of a place like the Psych Center. It was first built out of the Dorothea Dix hope for reform as being an asylum, a safe place. I'm not saying that all of the treatments that were done there, in the early days, they didn't really know how to treat mental illness. So some of the treatments were very were harmful and were not good, and they were painful to people. But it was what people thought. I mean, they were doing leaching for infections back then too. So we have to have a little perspective on it. If you go back, and I do want to mention, because a lot of people talk about electroconvulsive therapy as one of the horrific treatments of the past. And it's actually, and this is a perfect example, what was probably an inappropriate and unhelpful approach at the time, because of the way it was done, has actually been modified, and the treatment approach is very useful now for a select part of the population. So we have to change our thinking and to look at it now. It's done humanely, it's done painlessly, and I've talked to people who said it saved my life. It absolutely saved my life. So we've had a change, thankfully. And when I look at these two folks sitting here, I know part of the change is that we listened to the voice of mental health recipients, finally, and we listened to what was helpful. We engaged them in treatment as full and equal partners. That, I think, made a huge difference in turning things around.
Karl, you were treated at the Psych Center in the 1980s time period, and you also shared your experiences in the book, Buffalo State Hospital, A History of Institution in Light and Shadow. Right. Did you also undergo shock therapy?
I did actually. I remember pretty vividly at the time when it was initially proposed. I was scared, of course. Who wouldn't be? But I believe, if I remember correctly, I had a series of only 6. I mean, it really, I don't want to say snapped me out of it, but it did. It kind of snapped me out of this deep depression that I was in. I never had to have any further treatments, but it was something that really worked for me. And it really was something that I, looking back on it, I'm thankful to have had. I know people have different experiences. I think we are all individuals, and we all respond different ways to different types of treatment. I can only speak on my own experience, but it was very positive.
I want to get some questions too from our Facebook audience, so we can try to keep everyone included in this conversation. And we already had received some the last couple of days. And Brenda said that she has PTSD and has triggers, but was able to keep herself stable for 20 years. Recently, she was in a car accident and she had a trigger. She tried to seek a therapist that she went to 20 years ago, but was not accepted. She was rejected. So she's looking for some guidance on help and how to receive that help that's so needed. She says she's not well.
I applaud her for, recognizing that she had a trigger, knowing her own symptom pattern and seeking out help. And unfortunately, I think it has to do with a legal insurance issue that she was not able to get back to her original therapist. So I would say to her, don't give up. You know what you need. You might have to find a different therapist at this point. The Mental Health Association exists as a wonderful resource to help people find someone. And finding a good therapist is a very challenging thing to do. You sometimes have to go and try a couple of people or talk to a couple of people, make sure that they are up to date on your particular disorder, that they know how to treat it, and they have good experience with it, and you feel comfortable with the person. So I would suggest to Brenda, find somebody who can help you. There is someone out there. If you need some assistance with referrals, call the Mental Health Association, because they will give you names to call.
Excellent. Kelly, when we're talking about triggers, what are some triggers, if you can share that with our audience, that happened to you from your experiences?
Looking from depression is so vast for me. Panic disorder and generalized anxiety is easier to talk about from a trigger perspective. And it really would be some of the strangest things. But one of the, I would say, most important instances that happened on this path of healing was confronting my rapist. I, would have these panic attacks and my body would just shut down. I would start in my hands, and I had tests to figure out what was wrong. We didn't know if it was, MS. There was no idea. We didn't know what the issue was. And once I knew it was, we figured out it was a panic attacks, I could feel them when they were starting. So I start in my hands and move up my shoulders into my neck, and I got a LinkedIn request from my rapist, who I hadn't seen or spoken to for decades, and it threw me for a loop. I had a panic attack, but I was safe. I was in a safe place. The next time I saw him, I was actually at a work function, and I'm working. So, he walks in the door, and I'm like, well, I can't just pass out in front of 300 people. That's not going to work. So I talked to someone that was at the event that I trusted, and said, this is what just happened. This is who walked in. And I need you to know that if something happens, this is what's going on. And I could feel my hands tingling. I could feel, the anxiety moving up my shoulders. And I don't want to say I powered through it, but I believe the process of seeing him again via LinkedIn was the catalyst for me to be able to handle that face-to-face interaction. We didn't speak to each other. We were just in the same place. So that was a really turning point for me, to be able to have a panic attack begin, but not end in the typical fashion of me kind of passing out. No medication. It was definitely a new experience, but showed me the progress that I had made being in that type of situation.
Very difficult and compelling. Thank you for sharing that. Very personal. Karl, some triggers for you as well?
It's interesting. In my life, I have never really dealt much with anxiety. I've had many years ago, I've had a couple of panic attacks. So I think one of the main triggers for me is just not giving myself a break. Whether it be not getting enough sleep. Of course, living with bipolar disorder, that is something that is well known. That's something that's important in terms of self-care. So I know, for instance, if I'm having trouble sleeping, then I need to, evaluate and see where I'm at and make sure I take the appropriate steps to get the rest that I need. And, so I know that's critical for me. So that, if anything, if that's a trigger, that certainly would be something that could trigger my symptoms. So that's pretty much the main one that I have to deal with right now.
And just to take that into a slightly different aspect, since we started talking about suicide, I think it's also important for other people to know warning signs and what could be something that's giving us a clue that that person perhaps is thinking about suicide as an option. And as Karl says, it's going to be different for everybody. We all have our own ways of coping and not coping. But, some key things are to look for somebody to have a change in their behavior that is dramatic, or their mood. It's just not the way that person usually is.
How do you get them the help, though? How do you bring them to that point to say, we're going to help you, and step in their boundary of that?
It's important, I think, because we've talked about the increasing numbers of suicide, and we're all quite concerned about that. I think it's going to take a community response. It's not necessarily just a mental health response. We need the mental health resources, but we need community members who are willing to step up and say, I've observed this in you, and it's concerning, and I'm wondering what's going on for you. And then the way we talk about it, the biggest thing that people can do is to listen. Not to criticize or judge or say, I hope you're not thinking of doing something stupid. Because if you say that, that kind of shuts that conversation off completely.
Our words.
Yeah,
So
our
important.
words, the way we talk about it, and to listen, and to, most importantly, and the hardest thing to do, is to listen about the reasons that they want to die. Because embedded in those are their reasons for living. The things that are troubling them are the things they care about. And you need to listen to that and then say, together, we will go and we will get help and stay with the person.
And we are here to help too as well. On your screen you will see from time to time the National Suicide Prevention Lifeline, and that is 1-800-273-8255, 1-800-273-8255. And here in Western New York, you can always call the Crisis Service Hotline 24 hours a day, 716-834-3131, 716-834-3131. We want to make sure that you know that there's help out there for anything that you might be experiencing yourself or someone in your life. Maura from Tonawanda is asking, where is the respite for mothers of children that have serious mental health issues, especially in the summer months? Perhaps as providers and advocates, you can all kind of weigh in on that.
That's a very good question.
I know that NAMI has services for families.
That would be
specific to.
I'm
Go
sorry.
ahead.
Go ahead.
No, go ahead.
That would be another good referral to the Mental Health Association. They are well connected. If you go to the Mental Health Association website at eriemha.org, eriemha.org, there is a downloadable PDF, support group PDF, as well as other resources in the community that a person can look into. I think when we talk about support for families and so forth, oftentimes we forget that sometimes the individual is dealing with something that they might need help with, and they would need that extra support in a way that isn't maybe traditional. So, before our conversation, we talked about peer support. And peer support is invaluable because you have that experience of hearing from someone who's been there. And I think when you have that, nothing against, professional treatment. I've worked in the clinical world myself, and of course, I know there are a lot of very qualified, therapists, counselors, psychiatrists, and so forth, but having that lived experience and knowing, this is how I did it, this might help you, can be invaluable.
Yeah, Kelly mentioned NAMI too, which is the National Alliance for the Mentally Ill, NAMI, and they have a local branch as well. And I think your point about peer support is critical. It's very helpful.
It really is, and it brings us into a question from Julie that came in as well. She said, are there any clubhouse models for the treatment in Buffalo? And she referred to like the Fountain House in New York City, and you folks were familiar with that as a peer service provider for people. Is there anything that's similar here in our region?
There are things. We don't have a Fountain House per se model in Buffalo or Erie County that I'm aware of. But we have a lot of great peer agencies. Let's start naming them.
So Restoration Society is certainly one. Mental Health Peer Connection, which operates out of the West New York Independent Living Center. There's a new program called the Renewal Center, which is operated through West New York Independent Living, and I believe they are connect with Housing Options Made Easy in that service. It's a great program. It's actually a diversion program for those who might be in need of critical services, but may not need a full referral to, say, ECMC through CPEP. It's a way to help people that might not need that level of treatment.
I'm glad you brought that one up, Karl. That's a new program. I just visited it week before last. It's beautiful. It's designed to be open during the times that they have the highest turnout at the emergency room for psychiatric admission. And it's an option. So it's peer run. It's Restoration Society, Housing Options Made Easy, and the Independent Living Center, which we should also mention. And they run it, and it looks like a living room with a fireplace, actually, and snacks, and there's a nurse on duty. And somebody can come in and get connected to services or reconnected to services rather than have to always go to the emergency room where, you know, we know it's overwhelmed. They're overwhelmed at the emergency room, and it's not always the best place to go. Yeah. So this is another option that we now have in the community.
And if you're looking clinical, ECMC just opened up the help center. It's right on the campus in the family health clinic. And you can walk in, no appointments necessary, realizing that, again, you know, everyone is not at the point of a medical emergency where they need, you know, inpatient or CPEP intervention, but they may need more than peer support, or, you know, there's some other issues at hand. So that's something that the hospital saw and recognized was something that was needed. So it's called the Help Center. So if you call the hospital and ask for the Help Center, they will patch you there.
And you mentioned that there were higher rates at times. Are those traditionally holiday times, you know, situations where people might be down or by themselves? I mean, where do you see those levels rise?
They looked at times of day, and they that's why the center, the Renewal Center, is open 3 to 11, I believe, right now. That was the highest time for people to show up at CPEP, the emergencies, the psychiatric emergency room. They also, I mean, you don't necessarily see that big rise right on the holiday. Often it's afterwards, because people kind of somehow pull it together around the holidays, and then later is when you do see a bit more of a blip up.
Returning to the word stigma, Todd wrote to us, and he really said he was wondering what can be done to be less negative. Of course, a conversation like this right now is really supportive, and there's many programs in the community that are working to help that as well. He just asks, is there a way to put a positive spin on mental illness? But with that question, I just wanted to ask, is the fact that the State Office of Mental Health operating the Buffalo Psychiatric Center and programs throughout the region, they somewhat tend to put a mystery around what really happens inside the facility, and I think that's breaking open now more than ever of what's being done. But can you lend a little bit of taking away that mystery that I think continues to create the stigma?
It's an interesting point. I think that you know, we have HIPAA, which is guides us in terms of confidentiality, and so we have to be respectful of people's privacy, but it does, and that's across the board with medical and psychiatric conditions, and so that kind of at times can have us not be aware of all the mental health treatment that goes on that is very good and the positive things that are happening. I think that when people step up themselves, when recipients of service are willing to step up and say, this is who I am, you know, I'm getting health services and it's helping me. And for example, at the Psychiatric Center every year they have what they call the HaHa Conference. They probably have 200 people who come to that at least. Healthy alternatives, healthy alternative. There's two HAs, and
Yeah,
I
right.
forget what the second one is. Healthy alternatives to the healing arts, and it's run by people with mental health services who receive mental health services. It's a conference, goes for 2 days, and they have their own workshops. They have drumming workshops and laughter workshops and yoga and all sorts of things. And that's a wonderful way for people to then say, you know, these are just people who are getting services, and they're not afraid. They don't have to hide and not be able to tell anybody about it.
And if I can just say about that, really what we're talking about is empowerment.
Mm-hmm.
And in fact, years ago, there used to be the Empowerment Academy, it was called.
Yeah.
But the idea is that if you help a person in terms of letting them know that they can achieve more than they think they can, and give them the tools to do that, and if they see success, then they will feel like they can do more. And I'm a full believer that we can all do more than we think we can. Everybody can. Mm-hmm. But I've seen with my very eyes people that oftentimes felt like they couldn't do or perform or whatever, but have gotten good support and have been able to achieve and go further. And I think the thing is that you talk about stigma. One of the issues is that we don't, many people who are living with mental health challenges or concerns don't talk about it. So we don't know even if they're successful or not because it's not discussed. Yeah. So we really need to get that out in the open. There's a great program here in Erie County called the Anti-Stigma Coalition. And one of the features of the Anti-Stigma Coalition is to take the pledge to end stigma. And the website is letstalkstigma.org. And in that, by doing so, by going to that website, you sign up for the pledge to end stigma. There's a monthly newsletter that comes out to all the people that have signed the pledge, which gives events, information around mental health, and it's a great way to kind of turn that curve that we're in right now with mental health. There's also Just Tell One. JustTellOne.org is a program geared towards young adults ages 13 to 26, and it has great resources on that website as well.
I think with the stigma, the Anti-Stigma Coalition, taking the pledge includes things which I know you are a responsible media person, but we've seen examples where on major outlets they're talking about mental illness in very derogatory language. Language controls our dialogue. Language controls our thinking in a sense. And we have to be careful not to use words that make mental illness seem like it's something bad or blaming the person or use scary words. We have to stop talking that way.
A large part of it is education. When we look at, specifically the African American community and the stigma surrounding, diabetes, not even mental health. Mm-hmm. There's this belief that black don't crack, right? Mm-hmm. You have to be strong. You have to be a strong black woman. You have to be a strong black man, and strong means seeking help. Strong means being able to say, I need assistance. We need to look at where people go and where the stigmas are coming from, and being, I can't think of the word, but where they're not being addressed. So for example, the churches, we need faith leaders to say that your brain is just as important as your heart, as your knee, as your spleen, and it needs to be taken care of. It's not always an issue of praying enough or having more faith, or it's okay to have a therapist. It's okay to take medication if that's what you need. It's okay to take care of yourself. So I think in breaking that stigma, we have to make it comfortable for people to be able to tell their stories. And then from there, being able to make it more comfortable for people to seek help.
How difficult is it, though, in areas of low income and poverty, that when you see superstars like Spade and Bourdain take their own lives, and yet they probably have very good access to health care and mental health care, there's that disparity. What is it like for someone living in a situation where they don't have the resources or don't really maybe perhaps know to turn to these resources that are out there?
Well, that's where, in a case like that, you look to where people are going, and that's where the information needs to come from. So you look back at communities with lower socioeconomic statuses and less means. Then you also have to consider social determinants of health, which is like a whole nother Facebook conversation, right? But just to be able to scratch the surface, we have to take care to where people are. And we have to be able to have the conversations and offer things like peer support and health ministries and going into the barbershops and beauty salons where people actually are to be able to talk about things like this.
Right.
Yeah, and you know, a real underserved population, and this actually correlates with rates of suicide, our lack of services in rural populations. We can't forget. There's a recent uptick with farmers who are experiencing some very strong economic challenges right now, an increase in suicide. States where there are few mental health services have higher rates of suicide. New York is actually 49th in the country. So, you know, we need these services and we need to help people.
And when you look at the demographics and the breakdowns of different age groups that have the high rates, there's also the young girls. There's a very high rate among them for suicide. And then middle-aged men as well.
Girls tend to attempt suicide more than boys. Boys tend to die by suicide more frequently because they choose more lethal methods. Boys and men across the lifespan.
Yeah, I was going to say, let's expand it to women and men, not just boys and girls, you know, because then we have women that are attempting suicide that are going on to take care of their families. They attempt suicide that night and wake up in the morning, and they have to continue on with their lives. And then they're raising children, they're sick, and they're then continuing that cycle. So we're scratching the surface, which is huge.
Firearms,
Right.
having a firearm in the home greatly increases the risk because suicide is an impulsive act. And if I can swing back to what Karl said about his own experience with substance abuse. So you combine alcohol or drugs, which decrease your inhibitions, and then having a firearm present in the home, and something that is an impulsive act often can occur and be deadly. Whereas if neither of those two conditions were present, the person might have rethought it and had another chance to live.
And we're going to wrap up pretty soon, but there's two more that came in from Facebook, and this one's about suicide, very important. Rose from Buffalo wrote, we couldn't help our daughter because of privacy laws, so we really didn't know when she was in crisis. There must be a way to get around this. She committed suicide 2 years ago. Very sad.
I'm sorry.
That's so sad.
Yeah, I'm sorry to hear that. There's a big discussion going. I don't know exactly the circumstances, how old her daughter was, but there's a discussion I know going on about college campuses and finding a way to ensure that there is that communication with parents during. That was for you, Karl.
That was me.
Yeah.
That was me. I remember, you know, when I was really struggling. You know, I was 18, and of course, there was only so much that my parents were able to do. Mind you, like I said before, they were supportive, but in the end, I had to be the one to kind of take the lead and do that.
But this certainly goes back to all the concerns we've had on the campuses and the grade schools and the high schools of this issue of getting to that mental wellness, that mental health of a student. And we know now in July next month, this new state law is going to go into effect where schools, districts will have to have a mental health curriculum in place for this fall. So I'm sure they're all scrambling right now to work toward that. New York State Ed is helping with that. But what an important thing that's going to happen, I think, and we're going to see develop over time.
And that's huge because what we're realizing right now is that, you know, the younger generation, they're a lot more tuned into what's going on, I think, than we were perhaps when we were young. I mean, social media is that double-edged sword. I mean, and also the internet, online forums and so forth. But there are ways that they're learning more about mental health. And I think the younger generation, in some respect, are maybe a little bit more open about it, about discussing what's going on. And I look at that as being hopeful.
Yes.
For the future. And with this new law coming into place, I think it's going to really, hopefully, grow and develop, and if anything, change our culture.
You look at them
key.
all watching 13 Reasons Why, and I'm hoping we're going to have a sequel, 13 Reasons Why Not,
Yeah.
so
Right.
that people can see that there
That's
are options.
Very difficult film. We did some work on that last year for our education desk. One more Facebook question that came in. Val from Grand Island says employment issues are a big reason for not revealing mental health issues. And she asks what can be done about that. Of course, again, it comes down to your own privacy. But yet, I think there was just some information or a study out about crying in the workplace and also being aware of our coworkers and what lives they come from.
That's, we need anti-discrimination laws that are enforced. I mean, that's the way we crack through some of this, particularly the employment issue. That's very sad that someone can feel that they don't want to get help because someone at work is going to find out and hold it against them. We have to have a legal framework to challenge that type of activity.
And if I could just make one quick point about that, the Mental Health Association Erie County has a program based on workplace well-being, workplace wellness, that really goes into the community to businesses and teaches about how to recognize and how to manage and how to work with employees that might be living with mental health conditions. And there's also the question of going for interviews and what do you say, what do you not say? And that's always been a big debate about how to handle that. But in the end, there are protections in place. There's Americans with Disabilities Act and so forth that really can support a person if they need it.
Right.
Kelly, have you dealt with that?
I have, overarching, I would have to say it goes back to having conversations, breaking down the stigmas so that we know, as someone with depression is not crying all of the time. I'm not passed out in a corner from a panic attack every day. When we put a human face on what mental illness is, it better helps us understand that, oh my gosh, that's my coworker? Well, she's normal. We put these labels on people. And when we look past that and see people as just people, we're better able to have a safer environment. It goes beyond law. We have to have laws. We have to have protections in place. But we have to put a everyday face on the situation, which is why if you're comfortable sharing your story, it's important to share your story, because I can't tell you how many times people at work, in the grocery store, people have called me, in the parking lot of Aldi's, oh my gosh, Kelly Marie, I don't know you, but I'm so happy that whatever I said or you saw has had an impact on your life, because they are then able to tell their story. They're empowered. They're able to say, I have depression too, or I'm bipolar, or I'm bulimic. And when we look at the 400 diagnoses that there are, we usually just scratch the surface with one or two, but it's important to just realize that people are people.
Look at, and if anything, the Kate Spade and the Anthony Bourdain taught us that very productive, successful people,
Smiling, laughing,
right?
Yeah.
Can have mental health issues. So having a mental illness doesn't mean you're not going to be a productive person at work.
Right.
I'm sorry. On Facebook, Ruth said employment assistance programs are great resources.
Yes,
they are.
For mental
They're
health.
confidential.
This is what it's all about,
Yeah.
sharing our information and resources. One more thing I just wanted to ask all three of you before we close and finalize this conversation today. You talked about, connecting with people, and the words, we talked about language as well. We use words so easily. He's insane, she's crazy, I'm mental today, you're nutty. How difficult is it, from your expertise in helping folks and from suffering from mental illness, when you hear those words, what happens to you in your mind, and do you recoil?
That's a good question. I went through mental health first aid training, and mental health first aid, in a capsule, is an 8-hour training that helps raise awareness, reduce stigma, and so forth. And one of the things we teach in the program is how to address those stigmatizing words and what people use. And people oftentimes, it's just part of the vocabulary. We don't even think about it when we use those words. However, through my education and the work I do, for one, I don't use those words, but it took training. It took, thinking before I speak. You know, thinking about how the other person might feel if I use that word. And you know, sometimes the word is directed towards a person. Sometimes it's just used. Sometimes people say, "Oh, this is a crazy situation," but that's not quite the same thing as saying you're crazy.
Right.
You know, so we really don't want to label people using those words because that's what prevents people from getting help. That's what keeps people from, telling their story because they don't want to be labeled.
Yeah. And I think, if we take mental illness and add it to just illness, we don't say, oh my gosh, I'm so cancer today. We don't. So if we look at it from that perspective as well, I'm so diabetes, it's not a thing. And if we each one teach one, if we lovingly correct our friends and family, if we correct our children and with care and love and take the stigma off of it with correction, we're better able to change the vocabulary that we use.
Not calling people their diagnosis.
Right.
They're a person with an illness. And the other one that I think is so important, we should not be talking about, it's important not to talk about a successful suicide. Because for the person who attempted and lived, that's the successful. That's the good news. It makes someone feel like, gosh, I couldn't even do suicide correctly because I'm an unsuccessful suicide. So it seems small, but I think for people hearing it, it's important, and it is a conversation stopper when people use language that's disrespectful.
Dr. Spicone, Kelly, Karl, thank you so much. This has been a great conversation.
Thank you.
Thank you
for
for having us.
engaging our audience out there, and hopefully we can do it again. And this is great.
Thank you.
Thank you so much for being here and spending the time out of your busy days and your expertise and sharing your personal stories. Very important. We thank all of you in our Facebook Live audience for sharing your information, and maybe together as a community we can break the stigma and help those in need. I'm Eileen Buckley, senior reporter at WBFO. Thank you so much. Join the conversation on Facebook. Continue that conversation. Continue sharing information, and thanks.
Support for the WBFO Mental Health Initiative is provided by the Patrick P. Lee Foundation. The Lee Foundation envisions a community that is well informed about mental health, inclusive of people with mental illness, and served by high-quality treatment services. Learn more at www.lee.foundation.